to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professionals education. Now I'll point out to you in this series what's important, what's not so important. So let's go right to it. Okay, discussion here corresponds to page 118. And we are going to talk about selected response items now. Okay, the SR items, and it says here the most classic example is the multiple choice question. Multiple choice question, the MCQ. Okay, bear in mind that in some places when they use the word MCQ, they mean all types of objective questions. Under that comes the SBA, the single best answer, or what you call as the one best answer. Okay, and you also mean the multiple true false questions, right? But in some places when they use the term MCQ, what they mean is the SBA. Just be aware of this distinction. Okay. What follows is a few issues discussed under SR items, and the first is general guidelines for writing, and there's a nice table there in 7.4, table 7.4 in page 119, where it nicely summarizes the guidelines for writing high quality MCQs. Now this is a very important but long topic where I hope that you will go through, and it's very important, especially in faculty development. People need to know how to write a good MCQ. Okay, and what is important in this section is that the issue of constructive alignment again. Alright, so you can write SR items which assesses the lower order thinking skills, just recall, and you can write SR items which test the higher order thinking skills. Okay, so of course we would like to promote questions which, number one, stimulate students to use higher order thinking skills, as well as we have to make sure that if our objectives involves higher order thinking skills, we must use formats which measures them. So it goes both ways, like we discussed before. And in that sense, people usually divide SR items into recall items as well as and into application items. Application items. Okay, and the feature which differentiates these two is that application items usually employs a vignette, okay, which is a scenario. So we give patient data, history, examination, investigation, and things like that, and based on the scenario, based on the clinical vignette, the students have to answer, have to think of the possible, for example, the most likely diagnosis, what is the most important investigation you want to order, and things like that. Okay, so using a vignette is a common and a very good way of asking students to use higher order thinking skills in the selected response items. The author then discusses about avoiding flaws, okay, in the author then discusses about avoiding flaws in writing SR item formats, and he divides or classes these flaws into flaws of content, flaws of style, and flaws of formatting. Okay, so please have a look at this section. Content, what he means is that we do not make questions according to the blueprint. Okay, and it says there's the content flaw, as mentioned earlier, can be devastating. A poorly crafted or flawed MCQ that tests trivial content. So it's trivial content. There's a good word, something to remember. What it means is that we ask because we are specializing in that area, so we will make questions in that area, not realizing that, for example, our questions are for undergraduates. So that's a flaw that we need to be aware of. And flaws of style and formatting, they usually come together. And even though you have questions which ask important areas, but if you have flaws of style and flaws of formatting, the effect will be poor performance. Okay, so it says here, flaws of style and formatting can be relatively easy to spot and correct, but can be extremely problematic if not detected. Okay, so it gives a discussion about what are the common flaws of style and formatting, and this area is very important in faculty development. And one of the areas that we need to focus on when we do faculty development, you as medical educationists, of course, will be involved in this. So you need to be familiar with this area, because later on you will be training people how to write good MCQs. So you need to be aware of the guidelines that are available, as well as what are the common flaws. And as we have seen, flaws can be divided into content, style, and formatting. So have a look at this area. Okay. Now there is a discussion on page 112. 122. There is a discussion on page 122 regarding number of MCQ options. Now this is a popular discussion. As you know, for example, in the SBA, the single best answer, you have a stem, okay, followed by options A, B, C. Now, how many options should there be? Should there be until D or E, or should there be A, B, C only? Okay, a lot of discussion, a lot of studies has been done, a lot of debate. So the author gives an account of the debate which has been going on, the research which has been going on. A lot of studies point out that the optimal number is actually 3. Okay, just A, B and C. Okay, so one of them will be the answer key, meaning the true one. Let's say A is the true answer. So B and C are distractors, and the challenge is that we want to have good distractors. So B and C must be functional. Okay, functional, the convention is that more than 5% of candidates among those who do not know, okay, let's say if you exclude those who got this answer, the answer key correct, okay, you expect those who get this A correct are the good students, and those who choose B and C are those poor students. However, B and C, you expect them to be chosen by more than 5% of candidates from these poor students. Okay, so if less than 5% of candidates choose any distractors, they are called as dysfunctional. Okay, so research has pointed out or found that actually one answer and 2 distractors is the best that we can come up with. Once we are forced to make more than 2 distractors, so A, B, C, D, or in some places A, B, C, D, E, then more often than not, most of the distractors will be dysfunctional. It means, why is it dysfunctional? Because the answer is so obviously false. Okay, so it's the item is not doing its job of discriminating between good students and poor students. Okay, so please have a look at this discussion regarding number of options. Okay, and know that the optimal number is 3, but then you have to be aware of the discussion which is going on. Okay, scoring methods are the same. A lot of discussion, a lot of debate ongoing. Issues like penalty scoring. A lot of people are now advocating no penalty scoring, but of course there will be a group of people who say there must be penalty scoring. So what are the discussions for and against penalty scoring? Differential weighing, differential weigh, meaning you give some items more marks according to their importance and things like that. Correction for guessing, formula. Okay, it's discussed here. Okay, please, but the overall finding seems to be that a lot of people now are saying that there shouldn't be any penalty scoring, there shouldn't be any correction for guessing, and that it just should be plain and simple. Those who answer correctly get marks, those who do not answer wouldn't get marks, and those who answer incorrectly also will not be penalized. That seems to be the consensus nowadays. And lastly, there's some discussion about non-MCQ formats, and surprisingly it mentions here the true false format, although it's very common here in Malaysia, the multiple true false especially. It talks about the testlet or context dependent item set and things like that. Just these things are nice to know. Okay. So in summary, we've discussed a lot of things, and please know that this paper based, the constructed response and the selected response, they have their strengths, they have their limitations. So it's important for us to know what are the strengths and limitations for us to properly use it. And to properly use it, we know now that actually their place is the bottom two layers of the Miller pyramid, and therefore they should be used properly and accordingly. That's all. Thank you.